What if the most effective remedies you could make aren't in a pharmacy at all, but growing in your garden right now? Not because of ancient folklore or wellness trends, but because the chemistry actually checks out under scrutiny. We're going to work through 10 of them today, and for each one, I'll show you what the active compounds are, how they interact with your physiology, and exactly how to prepare them at home. Some of these will completely change how you think about what a garden is actually for. Number 1, garlic honey syrup. Most people keep garlic in the kitchen as a flavor base, something you sweat in a pan before the real cooking starts. But the compound behind that smell, allicin, is one of the most studied antimicrobial agents in plant biochemistry, and it only forms when you crush or chop a raw clove. Heat destroys allicin fast, so cooked garlic just doesn't carry the same weight therapeutically. When you pack raw crushed garlic into a jar and cover it with raw honey, you get a 2-compound system. The honey pulls moisture from the garlic through osmosis, drawing out water-soluble compounds over time, while its own low water activity and enzymatic hydrogen peroxide production add a second layer of antimicrobial activity. Clinical evidence shows alicin works against both gram-positive and gram-negative bacteria, which are exactly the organisms behind most common respiratory infections. Peel and lightly crush a full head of garlic. Pack it into a jar, cover it completely with raw, unfiltered honey, and flip it daily for the first week. After 7 to 10 days, you've got a syrup that gets stronger as it ages. 1 tablespoon costs pennies, and the pharmacy equivalent often contains compounds with weaker evidence behind them. Number 2, peppermint tea for digestion. Peppermint tea sits in the checkout aisle next to the fruit blends, and most people grab it because it tastes clean. They're not thinking about what the active compound actually does once it reaches their gut. Menthol is a monoterpene, and when it contacts smooth muscle cells in your intestinal wall, it binds to calcium channels and causes them to relax. That's a direct, measurable change in how your gut moves, not a vague soothing effect. Spasms ease, trapped gas moves through, and post-meal cramping settles. Multiple randomized controlled trials on peppermint oil for IBS are consistent enough that several gastroenterology guidelines acknowledge them. Steep a covered cup for 10 minutes. That saucer matters because menthol is volatile and escapes with the steam if you leave the cup open. Grow peppermint in a container since it spreads aggressively in open beds, but 1 pot carries you through the season easily. Number 3, Calendula healing salve. Medieval surgeons packed Calendula officinalis into battlefield wounds, and when you run the chemistry on why, it turns out they understood something real. The flowers contain triterpenoids and flavonoids that actively reduce inflammatory signaling and limit oxidative damage at wound sites. Clinical trials have tested Calendula against standard treatments for radiation dermatitis and diaper rash, and it consistently shows faster tissue repair than petroleum-based carriers. Pharmaceutical-grade Calendula extracts are now licensed wound care products in several European countries. Pack dried flowers into a jar, cover them with olive or jojoba oil, and let it sit for 4 to 6 weeks. The fat-soluble compounds migrate into the oil slowly. Then you melt in beeswax at roughly 1 ounce per cup of oil to get a firm, workable salve. The reason it's not in every medicine cabinet is simple. You can't patent a flower. Number 4, chamomile sleep tea. Most people assume chamomile tea works because it's warm and smells nice. The clinical evidence points somewhere more specific than that. The active compound, apigenin, binds directly to benzodiazepine receptors in the brain. Those are the same receptors pharmaceutical sedatives target. Apigenin's binding affinity is much lower, which is actually what makes it useful for daily sleep support without dependency risk or next-day fog. How long you steep it determines how much apigenin you actually extract. 2 minutes gives you a pleasant drink. 10 to 15 minutes with a saucer over the cup gives you something that measurably shortens sleep onset time. Grow Matricaria chamomilla, not Roman chamomile. The German species carries significantly higher apigenin content, and that difference shows up in results. Number 5, rosemary hair rinse. Rosemary for hair loss sounds like it belongs on a wellness blog next to crystal healing. So it's genuinely surprising when peer-reviewed literature turns up a randomized controlled trial comparing rosemary oil directly to 2% minoxidil for pattern hair loss, with comparable results at 6 months. The mechanism involves rosmarinic acid and ursolic acid. both of which appear to inhibit the enzyme that converts testosterone into DHT, the primary driver of follicle miniaturization. Steep a large handful of fresh rosemary in hot water for 20 minutes. Let it cool, and use it as a final rinse after washing. One established Rosmarinus officinalis plant supplies enough material for weekly rinses indefinitely, and the cost comparison with minoxidil isn't close. Number 6. Thyme cough syrup. Thyme sits in nearly every kitchen, and almost nobody thinks of it as medicine. In Germany, they do. Thyme-based cough preparations are licensed pharmaceutical products there, sold in pharmacies alongside conventional drugs. The active compounds, thymol and carvacrol, do two things at once. Thymol relaxes bronchial smooth muscle to reduce spasm, and it also works directly against the respiratory pathogens behind most acute bronchitis cases. One plant handling both jobs is why the clinical evidence got strong enough for drug licensing. To make the syrup, steep a strong batch of fresh or dried thyme in hot water, strain it, and mix it with raw honey in roughly equal parts. A tablespoon every few hours during an acute cough. Thymus vulgaris is drought tolerant, takes up almost no space, and a jar made in October carries a household through most of winter. Number 7. Basil Stress Relief Tea. Before you spend $40 on a foil bag of adaptogen powder, look up Ocimum tenuiflorum, holy basil, or tulsi. It grows from a $2 seed packet and it meets the clinical definition of a true adaptogen, meaning human trials have shown it actually modulates cortisol levels. The active compounds include eugenol, rosmarinic acid, and osamumicides. Don't confuse it with sweet basil in your garden. They look nearly identical, but the phytochemical profiles are completely different. Steep fresh or dried leaves for 5 to 10 minutes and drink it daily. The effect is cumulative, so don't expect a shift after 1 cup. Several weeks of consistent use is where the cortisol data gets interesting. Number 8. Sage Sore Throat Gargle. Sage gargle is one of the oldest documented throat remedies in European folk medicine, and the mechanism is simple enough to explain in a few sentences. Salvia officinalis contains tannins, and tannins are astringent, meaning they bind to proteins in your throat's mucous membranes on contact. That binding creates a temporary protective layer over irritated tissue, cuts local inflammation, and works directly against the oral pathogens behind most sore throats. A randomized controlled trial comparing a sage spray to lidocaine spray found comparable pain reduction at 3 hours, and lidocaine is a pharmaceutical anesthetic. Steep a tablespoon of sage in just boiled water for 10 minutes, covered, strain it, cool it, and gargle for 30 to 60 seconds every 2 to 3 hours. Number 9. Lavender Relaxation Oil. Lavender is so heavily marketed at this point that it's easy to write off the whole category as scented placebo. But linalool, the primary compound in lavender oil, directly modulates GABA-A receptor activity, and those are the same receptors that benzodiazepines target. It also dials down NMDA receptors, which drive excitatory signaling. The net result is measurable, not imagined. Pack dried lavandula angustifolia flowers into a jar, cover with jojoba or sweet almond oil, and infuse for 4 to 6 weeks. Studies on linalool inhalation show real reductions in heart rate and skin conductance, both objective markers of reduced stress response. Harvest the spikes just before full bloom for peak volatile oil content. Number 10. Lemon Balm Calming Tincture. Melissa officinalis doesn't get the same attention as lavender or chamomile, but it keeps showing up in the clinical literature on anxiety and sleep, and the mechanism is worth understanding. Rosmarinic acid, the primary active compound, inhibits the enzyme that breaks down GABA in your brain. Less breakdown means more GABA available, which means less neural excitability. That's a real pharmacological mechanism, not a vague calming claim. Pack fresh or dried lemon balm leaves into a jar. Cover with 40% ABV vodka, seal it, and shake it every few days for 4 to 6 weeks. Strain it, press the plant material dry, and you've got a tincture that keeps for years without refrigeration and delivers more rosmarinic acid per dose than tea ever will.